So please type questions that you want to be answered into the chat box. Sora Price Rollins, I'll turn it over to you to start the program. Thank you.
Thank you and good evening. Thank you so much for attending tonight's program, which is being hosted by our Social Action and Physical and Mental Health Committees. My name is Ruth Price Rollins, and I greet you in the name of the Greater Cleveland Alumni Chapter, of which I am president of Delta Sigma Theta Sorority Incorporated. I welcome you again as we collaborate with the National Council of Negro Women, which is one of our sororities' collaborative charitable partners. Delta's long-standing history and involvement with NCNW can be traced back to our soror, Mary McLeod Bethune, and extends through today with our soror, Siobhan Arlene Bradley, serving as president and CEO of NCNW, making her the 6th member of Delta Sigma Theta to serve as an NCNW president. How proud are we? As a national organization, Delta Sigma Theta advocates for the well-being of women. As a local chapter, our physical and mental health and our social action committees work collaboratively on programs centered around health justice. Over the past 4 years, these committees have collaborated on numerous programs, and those programs all help to raise awareness and funds. They encourage physical activity, health screening, vaccination, mental well-being, and promote health equity. Black maternal health continues to be an area of focus for our sorority. So tonight, you will hear from members of the healthcare community and legislators on the state of Black maternal health. Our goal is to continue to raise awareness, to identify solutions, and to advocate for the health of Black mothers and babies. Before our presenters begin, I'll turn it over to the NCNW chapters represented to bring greetings and to share information about their programs that are resources to the community and aligned with our 5-point thrust: Black maternal health and health equity. Thank you again for joining us, and everyone, please learn something. And at this point, I will turn it over to Ms. Essence Doucet.
Good evening. My name is Essence Doucet, Second Vice President and Membership Chair for the Cleveland Section National Council of Negro Women. NCNW is very excited to partner with the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated on this program about Black maternal health. It is my pleasure to introduce the presidents that represent the 3 NCNW sections in Cleveland for greetings. Cleveland Section President, Monica K. McClellan, Cuyahoga County Section President, Kimberly H. Jones, and Western Reserve Section President, Annette Lethwich. President McClellan.
Good evening. My name is Monica K. McClellan, and I am the president of the Cleveland Section NCNW. The National Council of Negro Women Incorporated was founded in 1935 by educator and social justice leader, Dr. Mary McLeod Bethune. The Cleveland section was organized in 1945 and is the first section chartered in Ohio. We have 78 years of service to the greater Cleveland community. The National Council of Negro Women is an organization of organizations comprised of 300 campus and community-based sections and 32 national women's organizations that enlightens, inspires, and connects more than 2 million women and men. Our mission is to lead, advocate for, and empower women of African descent, their families, and communities. President Jones.
Good evening. Thank you, President Rollins, for the invitation. My name is Kimberly H. Jones, and I serve as the president of the Cuyahoga County section of the National Council of Negro Women. The National Council of Negro Women, representing more than 2 million women of African descent, has formed a partnership with Vaccinate Your Family, one of the nation's foremost immunization advocacy nonprofits, to provide reliable information about the COVID-19 vaccines to communities being devastated by the pandemic. In late 2020, Vaccinate Your Family and NCNW launched Good Health Wins, Women's Immunization Networks, to raise awareness of the impact of timely immunizations for people of all ages and protect families and individuals from vaccine-preventable diseases. Some of the goals of the Good Health Wins program include an increase in public understanding and acceptance of vaccines, including those aimed at COVID-19, to combat myths and disinformation about the COVID-19 vaccine, to promote candid conversation and mutually respectful relationships between Black women and policymakers, to increase the availability of messages that resonate with Black and Hispanic communities, and finally, to implement strategies to reduce racial and/or ethnic disparities in adult vaccination coverage. President Leftwich.
Good evening. My name is Annette Leftwich, and I'm the president of the Western Reserve section of NCNW. In May 2021, the National Council of Negro Women created the Health Equality Committee. The Health Equality Committee focuses on 6 health targets: affordable health care, breast cancer, COVID-19, maternal health, mental health, and HIV and AIDS. The committee was developed to represent experts and professionals throughout the country and from various stages of life and experiences. The Health Equality Committee works closely with the Good Health Wins initiative. On behalf of National Council of Negro Women, we would like to again express our excitement to partner with the Greater Cleveland Alumni Chapter of Delta Sigma Theta Sorority Incorporated on this program about Black maternal health. Thank you.
Thank you, ladies, for sharing more about the NCNW and all of the work that you're doing to raise support around health equity, as well as support for mothers and babies. I'm Kalia Fisher-Grace, chair of the Delta Sigma Theta Sorority Physical and Mental Health Committee, and I will co-moderate this evening's session. I have the pleasure of introducing our first panelist for the evening, Jasmine Long, CEO of Birthing Beautiful Communities. Good evening, Jasmine. How are you?
I'm doing good. How about yourself?
I'm doing well. So Jasmine, our first question for you is, how do you describe the state of Black maternal health?
Sure. So in Northeast Ohio, we certainly know, and across the state, that we have a Black infant and maternal mortality crisis. During the pandemic nationally, maternal mortality rose by 33%. And our infant mortality numbers are not getting better at a rate that would actually, I think, make people like myself happy and make us feel that this is a safe community to birth in. When I look around and I see a lot of my girlfriends who are of childbearing age, who are either choosing not to become moms or who are very nervous about becoming moms, I'm very alarmed with the state of Black maternal health in Northeast Ohio.
Thank you. That is alarming, and I'm glad you brought up fear. I think that's something that hopefully by the end of tonight's session, not only will we raise awareness, but hopefully we don't want people to live in fear. So Jasmine, can you talk to us about Birthing Beautiful Communities? And more specifically, can you tell us how it was formed and what services are provided?
Sure. So Birthing Beautiful Communities is Northeast Ohio's only doula collaborative. And I'm looking around and I see my colleagues, Dr. Rice and Dana Langford, who work with us very closely to ensure that we train up our doulas. And doulas are labor and delivery support persons, but we also do case management work as well. So we are the only program in Northeast Ohio that actually attends the labor and delivery of clients that we serve. And so we are very highly trained birth attendants who are able to support women at the highest need. And I want to be very clear, and I'm still in probably Dana's thunder, is that we know that there is no saving Black women. Our socioeconomic doesn't save us, that we are at highest risk of mortality, morbidity, and our babies dying, even regardless of our social economic status. And so very being clear of encouraging women to be okay to ask for help, to support them, to really focus on mental and behavioral health challenges and needs, and to be there for the women across our county.
Thank you. I think you actually answered much of our next question, where we just wanted to understand from your perspective what role Birthing Beautiful Communities plays in improving the state of Black maternal health.
Sure. So again, during the pandemic, maternal mortality rose by 33% nationally. We lost not a single mom or a baby from 2020 to today. And I think that really, and we've served over, we serve about 600 clients per year. And I think that just truly speaks to Black women helping other Black women. We are an agency of 25 full-time staff, 40 doulas. Dr. Heather Wright, she don't really work for us, but she does work for us because she's our researcher. She allows us to prove the validity of our work. She allows our families to be able to say the things that have offended them. That when you have a dad who comes to a hospital appointment with his wife in a business suit, and a doctor makes a joke and says, "Oh, well, hopefully you won't be in jail by the time the baby comes." We don't joke like, see how we don't joke like that. That's not a joke to us. That's not funny to us. There's nothing funny about that. But that's what healthcare providers say to our patients and our clients sometimes, as a joke, as a way to kind of build community. They don't build community with us. And so our role is to be the translators, to step in when I have to go to the heads of the hospitals or when I have to go to the heads of the OB departments, or call in, like, who can I call? To be a support system for our families. And that is the role that we play. And that's what I get to play as the CEO, is leveraging my connections and relationships to be able to really provide a support system for the women that we're serving and the families that we're caring for.
Well, that's certainly a huge role, I would say, and I just want to commend you for all the work that you are doing to help in this space. Before we transition to the next speaker, I do want to ask those that are on the call, if you have any questions for Jasmine about Birthing Beautiful or any of the information that she shared, please feel free to type it in the chat. Jasmine, while we're waiting to see if any questions come through, can you tell us about some of the plans that you have to continue in your work? What are your plans for growth? Any of those things?
Well, I'm very excited. Today's a very phenomenal day because we did 2 meetings today here in the City Council. And at 7 o'clock, I believe a motion is going to be passed to give us $1 million to support our birthing center. So we are opening a 10,000 square foot birthing center that will be located on East 65th in Chester Avenue, where we're providing women with alternatives for birth. Right now, you can only birth at a hospital, or you can pay a fee to birth at home. And so we wanted to ensure that the 85% of Black women who have an acuity level to deliver at a birthing center can do so, and that they can have access to something different. And so that's what we're working towards. We're building up our doula base. We're having the conversation across the state, because we're talking about the state of Black maternal health. To the Republicans, I say to them, if you're telling me this is a pro-life state, if you're telling me that you want babies to survive and thrive, then you need to support our work. And so fingers crossed, right now we are in the operating budget to receive $1.2 million to support our work on the messaging of, listen, if this is who you say you are, then show up in that way. And so I believe that everyone has a role to play. Oftentimes when I speak, I get questions about, like, well, I'm not a parent, what's my role? I'm not a mother. I was a doula before I came to this organization. These are our sisters, our cousins, our homegirls who are facing these challenges. And so we all have a role to play in ensuring that our friends, our sisters, our girlfriends are able to bring babies into this world, that they're able to thrive, and that they're able to find success in their lives. And so all of us have a part to play in reducing Black maternal and infant mortality.
Thank you, and congratulations. That's a major announcement, and looking forward to all that you will do. There is a question that came through the chat, I think just to me, but the question for you, Jasmine, is, are insurance companies covering expenses of doula services?
Okay, so we have House Bill 142 that may be passed in this operating budget. It is something that we've been fighting for at least 5 years since I've been here, but I got the craziest message from my lobbyists that some Republicans are apprehensive to pass the bill because they think that we're going to be ushering women to have abortions. And that is not what we as doulas do at Birthing Beautiful Communities. So I don't know if the bill is going to pass, unfortunately. So as such, we are not eligible for Medicaid reimbursement. However, once the birthing center opens, it will be an opportunity for us to be able to build that into the services that we provide. I will say that we have contracts with 4 managed care providers and direct service reimbursement from CareSource. So that is something that we've been working on and advocating for a very long time. And hopefully we're able to get that passed through.
Thank you. The questions are rolling in, Jasmine. Does Birthing Beautiful also help with birth control, more specifically transitioning from hormonal to non-hormonal?
So, and this is a question that was asked to me today at City Hall. When there are questions like that, that's why I defer to a Dana Langford, a Heather Rice. I've deferred to the doctors. So we do have physicians come in and speak to our clients about contraception and how to navigate. Because again, we don't want a mom coming back to us 6 weeks later pregnant. And so we do have those conversations, but it is with providers who have the knowledge and the base to be able to have those conversations. So we do that as well. A lot of partnerships. So when I'm looking at my sisters around, Angela, Heather, Dana, these are my sisters. So we work very closely together because if we try to do it as one-offs, it wouldn't work.
Absolutely. There's a comment in the chat that says, I attend an HBCU and there are many mothers that are scared to continue school and fear they can't balance both. What events can my university regularly do to create a safe space for mothers to feel comfortable attending school?
I think this is where it's a very multifaceted question, but we have to be willing to push beyond the standard. And I think this is why, Dana and I see what we see in our work is that we don't stick to, okay, X, Y, Z is how it's always been done. You have to think out of the box. And so it will really be great for people to really think about how to support moms. And we have a teen program at BBC where if you get pregnant as a teenager, we actually stay with you until you graduate high school, because we never want you to feel that you had a baby, so that's a barrier to your success. We have to hold your hand. We have to provide those wraparound support services so that I'm okay. Somebody has my back. And that's why doulas are so critically important. And so universities should really focus on childcare and support for those people who are going to be in their institutions who have a child.
And how important are Black doulas to maternal health?
Critically important, because we are there as, again, we care so much because these are women who look like us, right? We are there to be a support system. We are the advocates. We are the sometimes mental and behavioral health providers that they need. So we train our doulas, and we have a network of grief recovery therapists where we do this for the whole community, is that we know that we have a lot of grief as African Americans. As folks who are dealing with COVID, we lost so many people. How many family members did we lose? And we just had to keep going. We had to keep pushing forward, and we didn't get to have a reset. And so we let our families know that it's okay to have that reset, that it's okay to focus on self, and it's okay to be selfish sometimes. It's okay to take care of yourself first. Like they say, you put your oxygen mask on first. And so doulas are there to be that support system. And our whole administrative team is there to be there and let folks know that it is okay. And then furthermore, when it comes to that healthcare settings, one of our doulas, and who is now a full-time staff member, Latanisha, did a video where she talked about sometimes stuff just goes wrong in that labor and delivery room. We are in that labor and delivery room. We are there to take pressures off the nurses. We are there to be a support system and a help for the doctors. And we're also there to ensure that our clients have what they need and are treated with dignity and respect. So that if somebody isn't saying to them, oh, I hope you're not in jail by the time the baby comes. That's our role.
Well, thank you so much, Jasmine. I think we could go on and talk, and I see more questions coming in. So hopefully we'll be able to get to some of those on the back of the discussion. I am going to turn it over to Meredith Turner, who is the chair of the Social Action Committee for Delta, to introduce our next panelist. So again, thank you, Jasmine. Meredith.
Okay, I'm sorry about that. I'm managing text messages, phone calls, and everything. I'm just looking for my remarks. So as mentioned, I'm Meredith Turner. It's my honor and privilege. Y'all know I love to do this, to serve as the Social Action Chair for our chapter. I have the distinct honor and privilege of introducing my friend, Congresswoman Shontel Brown. I wanted to get right into it. No long introduction is needed, but I will say that she sits on the House Agricultural Committee, where she's the ranking member of the General Farm Commodities Risk Management and Credit Committee. She's on the Subcommittee for Nutrition, Foreign Agriculture, and Horticulture. She sits on the House Committee on Oversight and Accountability, Subcommittee on Economic Growth, Energy Policy, and Regulatory Affairs. And she also sits on the Select Committee on the strategic competition between the United States and the Chinese Communist Party. I'd like to hear a little more about that at another time. But we're going to go ahead and bring on my sister, my friend, our Congresswoman, my predecessor. You just have no idea how elated I am that I get to follow in the footsteps of this giant. Congresswoman Shontel Brown, are you with us?
I am with you. I am with you. Thank you, thank you, thank you. Thank you for that awesome introduction. Councilwoman Turner, that just sounds so good. I just take so much pride and privilege in saying that with you being my successor and also a friend. I am so thankful for the opportunity to speak on an issue that has been a long concern in our community. I think at least I see some familiar faces on the call who I had the honor and privilege of doing some work in this space with. And so putting this event together and shining a spotlight on an issue that has been ignored for far too long is very, very important to me. Some of you may know the work that the initiative of declaring racism as a public health crisis when I was a member in that legacy seat, I would say, once held by C. Ellen Connolly also. One of the things that came out of our work around infant mortality and recognizing that in Cleveland, we have first-class hospitals, but we had third world infant mortality rates. Those things just did not go together. And so a group of people decided to do some real work, and I would be remiss if I didn't shout out Jasmine on this call, because I know she was a part of Birthing Beautiful Communities, was a tremendous part of the work that we did as it related to declaring racism as a public health crisis, because what we learned was it was systemic, structural, and institutional racism that was really the source of the health disparities that we were experiencing in our community. And it's inexcusable in one of the wealthiest nation in the world. So we've done some work here on the federal level, and it's a little bit heavier lift, admittedly, because when I was on county council, I like to tell folks I only needed about 5 or 6 folks to agree with me. Well, now I'm in Congress, there's a 435 member body, and getting to that 50% threshold is a little bit more work, but you can rest assured that I will not grow weary and I will not stop fighting to make sure that we pass legislation like the Momnibus, which I helped introduce, that has a compilation of bills that would help improve some of the devastating effects that infant mortality has had on our community. Just to name a couple, the legislation includes investing in community-based organizations that are going to be dedicated to improving maternal health. So we're talking about spaces and places where Jasmine Long works, like Birthing Beautiful Communities. It would also make critical investments to combat social determinants of health. When we introduced that legislation to declare racism as a public health crisis, I didn't want it to be just words on paper. I wanted to include real tangible results and metrics. And so we need to do this at the federal level as well to make sure we're making those investments so we can figure out those systemic, institutional, and structural barriers that are causing the stressors that are making it difficult for the people on this call to carry babies to full term. I also wanted to make sure that we increase and diversify the workforce, both in birthing and prenatal care, right? We need to see people that look like us, that understand our bodies, that do not give us the discount our feelings while we take extreme pride in carrying heavy loads and sometimes being perceived as super women. We are not. We still have, as I was coming onto this call, we need to take time to care for ourselves, but we also need people in the healthcare community to recognize that we are not super women, and we recognize our bodies, and we know when we're going through something, and to take that into consideration when we start putting out those cries for help. And last but certainly not least, as a member of the Agriculture Committee, when we're talking about healthcare and resources around food, WIC is incredibly important. So I'm looking to extend those periods from 6 months to 24 months for WIC eligibility, and also for the postpartum period from 12 months to 24 months for the breastfeeding period. We need time, more times with our baby. And we just had a report, I had a presser last week where we just talked about how Black women don't take the time off after giving birth. It's not because, again, we're super women, but it's just because we can't afford it. So we want to be able to give women the opportunities that the rest of our counterparts have been given and deserve. So again, I will close with this. I'm a member of the Democratic Women's Caucus and the Black Maternal Health Caucus. And so I will continue to support legislation that works to resolve the disparities and inequalities in maternal health. And with that, I don't know if I can take one question or two. They just called for votes, but I'm happy to try to do that and before my staff comes and snatches me off this call.
Halia, can you see, do we have any questions for the Congresswoman?
I don't see any for the Congresswoman, but maybe one that Jasmine answered that might be relevant. Congresswoman Brown, is there any role that you think men can play in this space? Maybe sure.
Absolutely. We need them as allies. They should be as much a part of this process as women. We carry the child for the duration of the pregnancy, but it should be truly a village mentality when it comes to our pregnancy. So continuing to be allies and continuing to be ambassadors, holding us up, standing by our side, making sure that when we're in these spaces where we have meetings with doctors, that they are equally championing the quality of care that we need and deserve. So I think that is a critical role. In a time where we have people, and I'll be very, very specific because it's a fact, it's not a partisan issue, but it shouldn't be. But we have Republicans that are trying to strip away our autonomy. We have white men who are trying to impose laws that do not give us the power to make decisions about our own bodies. So we need our brothers to be able to stand toe to toe to let them know you can't, in the words of the great philosopher Tupac, since a man can't make one, he has no right to tell a woman when and where to create one, right? So that's what we need from our brothers when we come into these spaces, for them to have our back. I got bars, so
She does, literally. You have to bring up some of those videos. We need them. We need you to do a video, Congresswoman, because there's so much going on here in Ohio. And I know we don't have enough time to talk about that today. That's not on the agenda. But do you have any events coming up soon? Any way we can support you?
I love you for that. Thank you, my sister. Perfect segue to close. Yes, I do. We have a town hall coming up June 3rd at 3 p.m. It is going to be hybrid. You can visit my website, chantelbrown.house.gov, for details and to sign up for more information and to learn about all of the amazing work that I continue to try to do since you all have blessed me with the opportunity to represent you in Washington. So again, that's chantelbrown.house.gov. You should see the information on our homepage as it relates to the town hall. And I'm just going to continue to try to bring you as much information as I can while pushing policies that are really going to improve the quality of lives for everyone, but especially those that look like us on this call. So.
Absolutely. Thank you, y'all. She's been kicking so much butt and Washington broke her foot.
Yes, I'm still scooting and booting, Meredith. That's why I gotta get on over. These halls of Congress are rough. They hard on the system, y'all. But
They
I will
are.
not let them bring me down. I will continue to stay in the fight. And I thank y'all for continuing to support me and to have my back. You guys have been a tremendous support, having the tremendous opportunity of following in the footsteps of one of your own, a legend in her own right, my predecessor, your sister, former Congresswoman, now Secretary of HUD, Marcia Fudge. She left a great legacy and big shoes to fill. And I'm doing my best to fulfill that and continue that legacy. And another predecessor, Stephanie Tubbs Jones, who we also lost too soon. But it's a legacy thing happening with this seat. Now I ain't gonna say nothing else about that, y'all.
Okay. Look,
pull me in. I'm here for the pull. All right, love y'all. Take care now.
love you too. Thank you, Congresswoman. So we want to thank her for taking time out of her busy day to help us understand all the efforts occurring at the federal level to support and improve the state of Black maternal health. So Kalia, I turn it back to you to introduce our next speaker.
Thank you. Next up is Angela Newman-White, Executive Director of First Year Cleveland. Welcome, Angela. How are you?
I'm doing great. How are you?
Good. Looks like you're multitasking in the background a little bit.
I can't promise he will not make an appearance.
No problem. We welcome that. Angela, please tell us about First Year Cleveland. How was it formed and what is its mission?
So First Year Cleveland was formed back in 2015 when the state of Ohio and Cuyahoga County had record high infant mortality rates for Black families. So our Black infant mortality rate in 2015 was, I think, 18.4, 18.5, which was significantly higher than the previous years, but also showed a 5 times inequity between Black and white births. And so, I have over 20 years experience in public health and working to combat the inequities in infant mortality. And so we know that there are so many great programs that were available in the county with the great healthcare systems, but it was thought by the local leadership that there needed to be kind of like an umbrella entity that could provide some support to community organizations, but also to be closely aligned with policy advocacy and fundraising.
Thank you. So I know this has been discussed just a little bit or talked about a little already, but can you talk a little bit more about how structural racism contributes to that infant mortality rate that you discussed, and maybe just shed some light on what is structural racism?
So structural racism, of course, which Jasmine and both Congresswomen, described, that is the system that's put in place to make sure that the racial inequities persist. So we're talking about how laws and policies kind of trickle down into what we want to describe as the social determinants of health, but it also justifies the mistreatment and the unjust treatment of Black women and Black families, not only in the workforce, in the education system, the criminal justice system. And that's when we talk about how, it's not the social determinants of health are not a protective factor for Black women, because regardless of your socioeconomic status, your marital status, you're still more at risk to have, a poor health outcome, morbidity, and unfortunately mortality. So the structural racism, of course, with infant and maternal mortality and morbidity is the root cause. I think that it allows the traditional system to place blame on individuals, right? To say like, if we just did this or we just did that, and not justifying or acknowledging the system's accountability piece that we lack. So what are the larger systems doing to make sure that there are anti-racist policies in place that ensure equitable access and treatment of Black and Brown families?
Thank you. We'll ask the same question of all the panelists. How does First Year Cleveland play a role in this space overall and just improving the state of Black maternal health?
So when First Year Cleveland was originally formed, it was heavily focused on the clinical model. And so it was very evident that, most of your health outcome, it doesn't get fixed or addressed in the medical office. And so, back in July, because we're housed at Case Western Reserve, we were at the School of Medicine and got transitioned over to the School of Social Work. So understanding the role that social conditions play in supporting healthier outcomes for families. And so what First Year Cleveland is committed to doing is to bridge that gap, right? To make sure that not only folks realize, understand, and do something about the role of racism in birth outcomes by providing education, trainings, and things of that nature, but we intentionally make sure that all of the dollars that we raise go directly back into the community. So that's funding organizations that are working with women, that are working with families that are here locally. I mean, a couple of our partners are on the call now, but then also, having a clear policy agenda that's rooted in anti-Black racism. So it's not that we don't care about our Hispanic families and our Asian families, but we have to be extremely intentional about all of the work that we're doing to support. It has to support Black communities and Black families. Also, another thing that I'm trying to put in place, I've been in this role for about 5 months now. And so I am housed at a research institution. And so I'm trying to shift the narrative to be more responsive to communities as opposed to exploitive. So traditional research has not been welcome, especially coming from where I'm at by the community. And I really feel like with the role in public health, we can be a little bit more influential in how not only data is collected and shared back, but that is solution-based, and that the investment goes back into the community and doesn't just benefit the academic institution.
Angela, thank you. I think that leads well into one of the questions that was in the chat from earlier. And the comment is that there appear to be a lot of community partners to work together to address the state of Black maternal health. In your experience, how have our major healthcare organizations made meaningful actions to commit resources specifically to address Black maternal health?
I mean, I think that there has been progress. So I think especially along the lines with the Affordable Care Act and all of the ARPA dollars that are coming through, there has been some more influence with regards to healthcare systems. And I don't want to say being forced, but they had to be more intentional about partnering with community-based organizations and addressing the social determinants of health. Traditionally, the large systems will just provide some treatment and send you on your way. But having the option, which I won't, steal Dana's thunder, that healthcare is about to look a little different, And so what Village of Healing is doing is like changing the game. And I think that that's going to force the healthcare systems to do an even better job of collaborating with community organizations, because there's this detachment, right? Like you're just in your bubble. You have no idea what happens when mom leaves your office. You can give her as many instructions or recommendations to improve her health conditions, but you're not influencing or providing any additional support for her to be able to enact those behaviors that you're suggesting. So we're getting better.
Okay, that's good to hear. One of the questions that was in the chat from earlier was around volunteer opportunities, and I think it's relevant to your organization. Are there any opportunities for volunteering with First Year Cleveland? What do volunteer relationships look like with First Year Cleveland?
So we're in the process of hosting some community events and listening sessions. So with the funds that we have available, I want to make sure that we're very intentional and responsive to what the community wants and not what the evidence base suggests. And so there will be opportunities. Our website is getting totally overhauled. So in July, go back to it. It'll be a whole different experience. But there's opportunities to assist with advocacy work. We'll have a public policy committee that will be relaunching to make sure that we have a clear line with not only the state legislators, but also working here locally on some policy and systems changes. And then, like I mentioned before, with the community events, and the partner organizations always welcome resources and volunteering as well. So, for diaper distributions, car seats, things like that, to help any family that has a financial stressor or barrier, we would welcome, baby products, baby items, and things like that. But we asked too, which was mentioned around the civic engagement piece, voting is really important. So any opportunities to help to encourage people to vote and to be active in the decision making, because the voter turnout here has not been very good in Cleveland. And so, how do we just get more people to be not only educated on what the issues are, because I think there's intentionally confusing to people, but then also encouraging, folks to use their voice and be actively involved.
Angela, thank you for sharing your time with us today. To only be in your role 5 months, you have so much wisdom, and we look forward to all the great work that you'll continue to do. And certainly we will keep our ears peeled for ways as a sorority we can support the work of First Year Cleveland. So just continue to keep us in the loop. And with that, I will introduce our next speaker. So I have the pleasure of introducing Dr. Heather Rice. Heather is a pediatric nurse practitioner and assistant professor of nursing at Cleveland State University. Welcome, Dr. Rice. How are you this evening?
I'm doing well. Thank you for inviting me to this very timely and important discussion.
Absolutely. Can you tell us more about your research and the work that you do in the community related to birth work as well as health equity?
Yes, I'll try my best to make it concise because I do quite a bit in the space of research, working with my sisters here at Birth and Beautiful Communities and Village of Healing Center. But in 2018, I kind of hit the ground running at Cleveland State University and secured funding for the Survive and Thrive, a New Future for African American Babies research project. And that project has kind of opened up different research opportunities. So some of the main goals of it was first to provide advanced training for the doulas at Birth and Beautiful Communities. So they've been offered trainings in vital signs, CPR, infant choking, community health worker training, in addition to a new element that has brought on my sister, Dana Langford, as a certified nurse midwife, with the lab simulation obstetrics experience over at Cleveland State's lab, where we have the doula simulate a birth with a mannequin. And Dana is there, and she successfully delivered a healthy baby, and mom's healthy last week. So it allows our doulas an opportunity to be in the hospital setting and kind of simulate what they might see in the room, so they're more acclimated to that setting. So that's one aspect of the project that I'm very passionate about. In addition to our fatherhood initiative, where we're collecting data on Black dads and their experiences and what types of services they want to see offered to support them. That study looks at anxiety, depression, resiliency, support with fathers. It also looks at their work harassment experiences, because we know Black men sometimes have difficulty securing positions that offer them enough funding to be able to support their families. So we look at that, and we're holding focus groups to get dads' perspectives and their insight about how they're feeling. And then another major part of it is the development of a perinatal support mobile app called Thrive. This app will be used by families that work with Birth and Beautiful Communities. It has different features that moms can use, the main aspect being mental health support, and building out Birth and Beautiful Communities Breathe project and their programming that helps moms to address depression and anxiety and those things that we see in the postpartum period. That's my work with Birth and Beautiful Communities. And then about a year ago, I started conducting research with the Village of Healing Center. That's a process evaluation. So we are looking at the Village of Healing Center, what went into creating a safe, welcoming space for Black women. If you haven't been, here's my plug to encourage you to go. It's very intentionally made for us. It feels welcoming because there was intention placed behind it. And I wanted to be able to capture, what does it take to make a space that feels safe and welcoming when you want medical care? So we're looking at that. And then we're also looking at healthcare utilization, medical racism, medical mistrust, and just discrimination that women may have experienced in the medical settings and in a hospital.
Well, that's a very, very extensive and impressive program of research, Heather. One of the things you mentioned dovetails into our next question. We know that you work with federal agencies, including the Health Services Research Administration, or HRSA. So 1 year ago, I saw an announcement that about a year ago, HRSA created the National Maternal Mental Health Hotline, or for those that are in the audience, is 1-833-TLC-MAMA, or 1-833-852-6262. That's important, especially in the month of May, where this is Mental Health Awareness Month. You talked a little bit about this, but can you maybe just talk a little bit more about the importance of maternal mental health and why a government agency like HRSA would find it important to create such a hotline?
Absolutely. So as we all know, everyone experienced COVID in some capacity, and we've discussed that. And I believe that people are still beginning to process how mentally we have been impacted by an experience where people were disconnected essentially from a lot of things that help them to maintain their mental health, traveling, dining, spending time with friends and family. It was a very isolating time in our country. And I believe for maternal health, it's very important because particularly African-American women experience 2 times the risk of postpartum concerns related to depression and anxiety. And we want to make sure that women are educated about those things, but also able to identify those symptoms early on so that they can get the services they need. So this hotline is so important. I was able to see that since they launched 1 year ago, they have received over 12,000 outreach, with 70% of that being calls and 30% of that being texts. So it really just speaks to how people are not only suffering and dealing with different aspects of depression and anxiety and other mental health disorders, particularly in that postpartum period, but that they're also looking for resources, because essentially that's what that hotline was designed for, was to be able to connect people to resources and the support that they needed, providers, different types of care. I see in the chat, a lot of people are saying, how can people find out about these things? We have so many amazing services right here in our community, and a lot of them that have been designed specifically for us. So I think it's important that HRSA found a way to be able to connect people directly to what they need based off of what they're experiencing.
Thank you for your insight. So a similar question to you as we've asked for the other panelists, what role can nurses play in improving the state of Black maternal health?
Absolutely, that's a great question. Nurses are very important. They're in the hospital settings or in the community settings. They have a role with educating. They can be able to educate patients about signs and symptoms, helping them to understand what to look for. They're also awesome advocates in the hospital system. Doulas are more community-based and they go into each system, but nurses are right there in the system. If they're noticing or identifying concerns related to bias, they're there to be able to address those things there, right while it's happening, and bringing it up to their charge nurses and other people that are there on the unit. Of course, able to lobby, helping with laws that support women, advocating in that way, educating the community about why it's important to vote at different times so that legislation's not passed that limits women's rights and their protections against their own bodies. And then lastly, something I always tell my students is know your community and your resources. A lot of times the social workers are not available on the floor, so you become the person who knows all, can speak on all, and tell all. So knowing which organizations are available, who Birthing Beautiful Community is, who Village of Healing Center is, knowing who they are and what they do, how they offer for moms, particularly those who are pregnant, is very important, because you might be the person that your patient's looking for those answers for. And if you're already informed and aware that, it's really great to have that accessible and ready for a patient when they need it. And something else that Angela mentioned that I speak to as well is I think it's really interesting that my background was nursing and then I went into research because I've always advocated for patients. So I'm very intentional about the way in which the research are being shared, the way that the narratives are being highlighted, because I recognize that these are my sisters, these are someone's mom, sister, daughter. So I'm very intentional in that way to not take advantage of the data or use the data in a way that is harmful, and also being able to focus on highlighting the pluses. I'm kind of exhausted with the disparities. So I think it's wonderful at Birthing Beautiful Communities. We have a resiliency model study that we have where we're looking at the infants that have survived past that first year. What does that look like? What types of indicators are important to look at? And then at the Village of Healing Center, what's really awesome is looking at how does having a Black provider, someone that looks like you, how does that improve your access to care, your utilization of care? We know that labs and other preventative measures tend to increase when your provider looks like you. So not just always focusing on what's bad about our community, what we haven't done right, what more percentage of this are we at risk for being affected, but also looking at where we shine as a community, where we do thrive, where we do well. So that's something else that I'm very intentional about, and that comes from my nursing experience.
Thank you. I love that. It sounds like focusing on asset-based community development versus denigrating a community just to get what it is that you want. So there are some questions in the chat for you. One, recognizing and thanking you for acknowledging the roles that nurses play in lobbying. And I think there's a question asking, can you talk about weathering and the impact that daily stressors have on Black women's health?
Absolutely. Hi, William. So weathering is a term that's been coined by Professor Geronimus. It looks at how the collective stressors that Black women experience at a higher rate than any other culture impacts their bodies on a genetic level. We actually can see from the level of our telomeres that there is a difference in the length. Our bodies look older than they should be because of the stress and the constant wear and tear that we experience from daily life, having to experience differences in pay, microaggressions, implicit bias, institutionalized racism. I can go on and on. Suffering through those things and constantly showing up as a strong, loyal, consistent Black woman is tiring. And we're starting to see beyond just from our voices and sharing it, but actually on a genetic level and on a DNA level that our bodies are impacted by those things. And it makes us more likely to have problems with our pregnancies because that cumulative stress causes our bodies to be more at risk for some of those chronic conditions, such as gestational diabetes, preeclampsia, hypertension, and then our babies are more prone to be premature. And then we know the prematurity causes that increase in our infant mortality rates. So when we're aware of this, when Black women can kind of take control of that and be in control of responding to that, understanding how we're stressed, then we can begin to incorporate things that pour back into us, finding ways to care about ourselves, prioritize our own care, because we see that we're at that higher risk and we're going to do what we can to try to prevent the risk of some of these adverse health outcomes.
Thank you. There's another question asking for what advice you would give to couples who are scared to give birth at home due to stories such as a recent Black couple living in Dallas whose 2-week-old daughter was taken because they decided to have a home birth with a midwife.
I would like the midwife to answer that question. I'm not. No, I can say to that one advantage is that here in the city of Cleveland, we will be having options for birth as a result of the birthing center being brought here, but also being educated not only about that, but knowing how you can at least address hospital concerns, having a doula present, ensuring your provider is a nurse midwife so that you can have those better outcomes and being able to protect it in that way. I don't have a lot of experience with home births, so I don't want to speak specifically to that. But when you're educated and you're aware and you know what your options are and you put as many things in place that you can to protect yourself and your family, that's the best thing that you can do. Because we do know the hospitals do not have the best outcomes, and we know that that's something we're continuing to address and look at. But when you put things in place, you're informed. If you are concerned about something that you're doing with your care, and you just ask a follow-up question of why are we choosing to, move into an induction? Why aren't we waiting? Or is there a medical reason that validates the C-section? Things like that, working with your providers to understand that, then you can absolutely prevent some of those things that we see happening across our nation.
Thank you, Dr. Rice. We appreciate your time and look forward to seeing all the changes that spring forward from your work. In any ways that we can be of support, please let us know. I'll turn it back over to my co-host Meredith Turner, to introduce our final presenter.
Okay, now that I'm off mute, thanks, Kalia. I have the pleasure of introducing Danae M. Langford, CEO and Medical Director of Village of Healing. And I would be remiss if I didn't say, Danae, remember when we had you on, I think at the very height of COVID, and I think we watched the movie Toxic, and you remember that when we had you on?
Yes, absolutely. And then when I just presented to your committee, Councilwoman Conwell ended up bringing it up, like, didn't I meet you before? So yes, absolutely.
Right, she was trying to put her finger on it.
Yes.
And I have to say, from that point to now, I have just seen your growth and development, taking your mission to the next level, bringing everything to fruition. And I had the opportunity to attend one of your fundraisers last summer on the top of, I think it was the 9. And you were so beautiful with all of that color on. And I was just like, oh my God, this sister is really speaking truth to power in this space. And so I just want to, again, thank you for all that you have been doing. Can you tell us about the Village of Healing, when it was formed, what is the mission, and what services are offered?
So Village of Healing is a community development organization with a different approach to healing, in that typically, especially in Cleveland and Cuyahoga County, what we've noticed is that there's a white saviorism complex, and that we depend on everyone outside of our community to try to figure out how to decrease racial disparities and things like that. But what we know is we have everything we need inside of our community. And when we depend on those resources that are in our community, the results are better, the outcomes are better, all of those things happen. And so what we decided to do with Village of Healing, myself and my co-founder, Tanisha Gaines, we were attending all of these meetings where they were talking about infant and maternal mortality. And it was now the buzzword because funding was now attached to it. However, when we walked into these rooms, no one looked like us. The people that were presenting on the stages didn't look like us, but we were being told as a community, this is what you should be doing. And whenever we had solutions or action steps, we were being completely ignored, or we were being told that we needed 5 to 7 years more data. And one example that I always give is Angela Newman White, and the 44128 zip code went from being the absolute worst as far as infant mortality rates to going out in the community, knocking on the doors, asking community members, what do you want? What do you need? How can we help you? And not just telling them this is what you need. You need a bus ticket, or this is what you need. You need an incentive to go to the doctor. But truly having conversations. And I had the opportunity to participate in some of those community conversations. And from doing that in 365 days, they went from being the worst to 0 deaths the next year. And so myself and my co-founder and partner, Tanisha, started packing up our stuff. We were like, this is it, this is the answer. And they were told that they needed 5 to 7 years more of data. Well, myself being in my reproductive years, knew I didn't have 5 to 7 more years to give. And Tanisha had just told the story of how she was waking up every single night to check on her baby who was under 1 to make sure she was breathing. And so we started the Village of Healing with community programming. We wanted to join these Black community-led organizations that were truly doing the work and saving lives. And in that same token, when Bloomberg and City Lab came out with their study to say that Cleveland, Ohio was the worst place to live as a Black woman, and then second to last in healthcare outcomes, I remember going to work in our large, predominantly white hospital system, and they were flabbergasted, like gasping, clutching their pearls, like this can't be. But we knew it. We knew it working in the system. We knew it as providers in the system. We knew it as leadership in the system, that this was exactly the case. And so a lot of research was also starting to come out about your provider looks like you, your disparities decrease, your outcomes are better, your satisfaction with your care is better. And so we stepped out on faith. And we started the Village of Healing Center, which is the first and only Black owned and operated healthcare center in Ohio. Our 90% of our board is Black, our entire leadership is Black, and our entire staff is Black. We provide Black providers to take care of Black patients. So you are going to come to the Village of Healing Center and see a Black nurse practitioner, a Black mental health therapist, a Black provider for your care. And that care includes obstetrics, so pregnancy and postpartum. It also includes women's health, so your pap smears, your breast exams, contraception, all of those things. And we see women, my youngest patient is 12 years old, all the way through menopause. My oldest patient is in her 80s. And so we provide that care to Black women right now. And then our mental health therapist sees all Black men and women over the age of 18 years old. In addition to that, we do offer 2 community programs, our Mother to Mother program, which takes Black moms that are going through a maternal mental health complication and pair them with Black moms that have recovered. And we're very loose with that term, maternal mental health complication. COVID showed us that 70% of women, especially postpartum, go undiagnosed or underdiagnosed. They haven't come out with the disparity yet, but I would be willing to put 10 years of my salary on the fact that most of those women are going to be Black women. And so we're very loose with that term of maternal mental health complication, and we just say support. And then we also offer our Black professional women's group, which takes Black women over the age of 30 with at least a bachelor's degree, and it gives us a voice. A lot of times in this conversation about infant and maternal mortality, there's a lot of victim blaming. And we saw that when we started, that it's these poor Black women. And if they would just go to their appointments, if they would just do what they're supposed to do, these numbers would come down. What we know is that this is crosses socioeconomic status lines. And in fact, because I am over 30 with a master's degree, as a CEO and medical director, I'm actually 6 times more likely to die in the childbirth complications.
Wait, what? Can you say that again?
I sure can. What we know is that when you're over 30 with at least a bachelor's degree, your rate increases from that 3 to 4 times likely rate to actually 6 times. So I am 6 times more likely to die than even a white woman with a high school diploma. And so that is the conversation that's always ignored. We typically tend to think it, and we do as Black women too, that this is a poor Black woman's problem. And we know that this crosses socioeconomic status lines.
Well, thank you. That's a lot. And so our Congresswoman, she, proudly, boasted about the fact that Northeast Ohio has some of the best health systems in the world. We have Metro Health and University and the Cleveland Clinic. And, you know, what do you say to the naysayers that say we're doing enough? We have the best health systems in the world. And so this can't be overstated. Why do we need a village of healing?
I would politely refer them to any Black woman walking on the street to ask them what was their experience in the last 5 years when they were seen at one of those medical centers.
And so because I know they think they are in many ways doing great work, right? But why do we need a village of healing in addition, in all fairness, to those amazing health systems?
Well, and so Village of Healing is a healthcare center. We are not a hospital. So we still rely on them for their hospital services, right? If I need to refer to a specialist, I send there. For your delivery, until the birthing center opens at BBC, I send them there for their deliveries. The difference between Village of Healing and all of the other medical centers is that culturally sensitive care. Black people are relationship people. We build relationships. It's why even my mother, her primary care just left, and she is devastated. Like, she can't even think straight about where to even possibly go. But we are relationship building people. And so when you walk into an office where your provider looks like you and you're able to have that relationship building all the way down to the language. And that's an example I use. I remember working in healthcare systems, and one of the providers said, I can't stand when these people say it's been going on for a minute. Well, for me, I was like, oh, shoot, they've been in pain for a long time. It was very simple. But for them, all the way down to language, it's difficult to understand. And so we're always expected to code switch in those situations. And we're expected to make those providers feel comfortable. Where at Village of Healing, the focus is your comfort level, right? The focus is we're going to have that culturally sensitive dialogue and care, where I'm going to take into account that even as a professional Black woman, you walking in with that weathering going on. I know that you got everything going on at work. You might be helping your niece. You probably helping your nephew, in addition to your own family and your own household. And so we want to make sure that culturally sensitive care is being utilized, because we know, and the studies show, it improves outcomes and patient satisfaction.
So Sharice Edwards in the chat said that Serena Williams almost died after giving birth.
Mm-hmm. Absolutely. Serena Williams, Beyonce talks about her story and how she wasn't listened to. I think it's Alex Fields, or the track star. She talks about her story and how she ended up with preeclampsia. This is an across the board. It doesn't matter your income level. It doesn't matter your age. The only thing that matters is your skin color. And we know that because Black women aren't listened to. It's been taught as late as 2012 in textbooks that Black people's pain tolerance is different and higher. And so one thing that they did at one point says saved us in the opioid crisis, which I just recently heard that Black people are now more addicted. Our numbers are going up as far as fentanyl, but originally it saved us because they didn't believe that we were in pain. So they wouldn't give us pain medicine, and so we didn't become addicted. And so what we know is this is an across the board issue. It has nothing to do with your degrees, your income. You can walk in. My business partner who worked at the hospital she went to for ER care was told, I'm going to write you a prescription for Tylenol. Your care source going to probably cover it. And here she is with a master's degree working in leadership at that hospital. So it doesn't matter.
Jasmine Abernathy in the chat talked about those being some scary statistics. We talked a little bit about toxic earlier, and my question is about, and we know what uneven propaganda will do. I mean, they basically dehumanize Black people in the media and film. And I wanted to know if you could talk about the role of film and media in improving the state of Black maternal health.
So I think the biggest thing is Birthing Justice just recently came out, and I thought it was one of the best done documentaries to discuss the state of maternal health and Black health. And the reason being is because a lot of times when these documentaries come out, you know, we don't get highlighted, or professional Black women aren't highlighted. And so there is that conversation that is always for Black women versus the higher socioeconomic status Black women. But they purposefully, I believe, utilize higher socioeconomic status women to tell their story of near-death experiences. And so I think that that was one of the great things about that documentary. But my favorite part is that it ended on Black joy. And so, you know, a lot of these documentaries are coming out and it's scaring individuals. Like, you know, Jasmine said earlier, I literally have friends that are saying, you know, I'm not going to do the children thing. You know, I don't want to do it. I watch your panels. I watch you discuss it. This is a life or death matter for me, and I'm going to choose life. But birthing justice ended on Black joy. And so that's why it was one of my favorites, because that's how we can highlight and make it good. It's to talk about the joy. And I think that we lose that a lot of times because we know what the statistics are, but there's still a lot of Black women that carry to term. And this is why we utilize culturally sensitive care. We utilize the Black providers. This is why we utilize the Black doulas. You know, an example we have at Village of Healing is, we had a patient that had 3 preterm deliveries. She had never, ever delivered term. But working with me as her midwife and the doulas from Birthing Beautiful Community, she delivered her first term baby, to the point where she begged for an induction because she was so tired of being pregnant because she had never made it to term. So that's the joy, and that's what the media needs to focus on. Focus on the Black organizations that are actually on the ground doing the work and making a difference, and not these hospitals that are literally killing us.
Okay. Kalia, I mentioned earlier that we might pull an audible. We kind of a little ahead of time. Do you mind if we open the conversation back up to all of our panel members? Okay. Okay. So I was wondering if, you know, as you ladies were listening to the discussion, was there anything, you know, was there a burning desire for you to share anything? And if so, just jump in.
Okay, so there was only one thing, and I thought my sister Danny was going to do this, and she didn't. It was about that home birth question. And so in the state of Ohio, you can only legally have a home birth with a certified nurse midwife, and there are some certified professional midwives who have the ability to do home births. We do live in Ohio, and as such, if you're going to have a legal home birth, you got to do it the right way. Unfortunately, because if something goes wrong, then you are liable. So it is a very unfortunate state that we live in, but it is very important to have someone who can be a support system to you, you know, because again, things can go wrong. You pray that they don't, but if something does go wrong, you want someone who's able to be a support system. And so that is, to Dr. Rice's point, why we were trying to do the birthing center. But in the state of Ohio, and if Dana has any thoughts on this, it is very restrictive around how we are allowed to birth, unfortunately.
And I always go a step further to promote certified nurse midwives. So right now we have 3 Black certified nurse midwives in Cuyahoga County that are doing home births. And the reason I go as far as to do and say certified nurse midwives is what Dr. Rice mentioned earlier, as the cue up from I can't think of his name right now, but it was the cue up from him on weathering. On William, I'm sorry, or the cue up from William on weathering. What we know is when Arline Geronimus decided to coin that term weathering, and she was looking at her white colleagues at college and how they were living this great, carefree, happy life in comparison to the Black colleagues she was working with in the inner city who were having all of these chronic conditions. So that weathering causes our systems to age much quicker, putting us at risk for those chronic conditions. A certified nurse midwife is trained in the physiology of when things go wrong. And just like I told the doulas last week in our training, 90% of the time, birth is the most beautiful thing you ever want to be a part of. I always tell people I get to watch God at work every day. However, 10% of the time, it is one of the most scariest things that you will be a part of. And so when you're with the certified nurse midwife, they're able to assess that immediately because of the physiology, the pathophysiology, and the medical background that a certified nurse midwife carries.
Okay. There was a question about Roe v. Wade, and let's see, how unevenly has Roe v. Wade decision affected Black women through a socioeconomic context, or however you choose to answer? Anybody?
So there was an article that came out today, I believe it was in the New York Times, talking about what it means to have a baby that you did not plan for and that you are not in the mental space to have. And so while we have not necessarily seen the impacts of what the Roe v. Wade, and we are in Ohio, we have the Heartless bill, I like how my colleagues say that. We don't necessarily know how it's impacting us now, but all we know is that we have to be there for the people that we're serving. But it is not good. Dana's a provider, and she may have to make decisions like, can I actually support this woman who is in a situation where she is needs to have a medical abortion, and I don't know if I'm going to go to jail because I provided these services, right? I don't know if I'm going to lose my licensure because of this. But again, we are Black women who serve other Black women primarily, and so we're going to do what we got to do. And so it's a very scary time, I think, for providers. It's a very scary time for women. And when you're talking about the toxic stress that really goes into infant mortality, I think that has to dovetail right in.
Okay. Thank you for that, sis. Danae, can you
Councilman, there
talk?
was another question in the chat that was asking about from Carmen, I believe. And it was talking about, like, how do women know about these services? So we are doing a lot of promotion, and thanks to First Year Cleveland, I think Dana and I will both have ads on the radio talking about our work, getting folks to recognize the services that we offer and to be able to come into the door. And also we have to leverage folks around the table. And I think all of us who do this work, we are not limited. This is just not, and again, I get annoyed when folks talk about, like, oh, it was a lower socioeconomic status issue. Does that mean that the babies deserve to die? No, right? So we know that Black women are a target, regardless of their socioeconomic status, regardless of their marital status, partners, wife and wife. We want to be a support system for any birthing family who needs support. So that's how folks can find out about these services. And again, these are newer services. When I talked to City Council Chair, I said, this is catalytic work. We've never, as Black women, been allowed to lead work that is impacting us specifically. We are now positioned to be able to be the leaders of work that is directly impacting us and to lead the charge and the policy making around what this looks like. And so go ahead, Councilwoman, I'm sorry.
Oh,
Well,
no,
real
thank
quick,
you, sis. Go ahead.
Can I jump in real quick? I'm sorry. The one thing that I also know is that we rely heavily on word of mouth. And so while the radio has been awesome for us, and we are forever grateful for First Year Cleveland, because I don't know if y'all know, radio ads are like sky high. That's the only way to describe it. But we are also a word of mouth. And so one of the things that we are combating at Village of Healing is this generational commitment that we have to hospital systems here in Cleveland. Like I said, my mom is devastated that her, primary care person has left. And so I've been having conversations with her about seeing somebody outside of the medical system. And even though that medical system has been dangerous for her at times, and it has, she had a knee replacement where she wasn't given her pain medicine timely, or she had to use the restroom and was forced to wait an hour and a half for someone to come and get her up to take her to the bathroom. She has a generational commitment to that hospital system. Her mother went, and her aunts went, and her nieces went, so she feels like she has to go too. And we have to break that system and that mentality and thought and that commitment, because those systems are harmful to us. And the studies have shown us that this is the second worst for us as far as healthcare outcomes. So the only way we combat those systems are taking our money from those systems. And there's a lot of us that are leaving those systems to create our own. So seeking the care in those systems.
Okay, there was a question, there's a question about the significance. So tell us about your center and how you set it up, the significance of the rooms being named for Black women. Tell the story. We want to hear the story.
Okay. We were very intentional with the setup of our clinic because we wanted Black women to walk in and know this was their space, right? I think in healthcare, a lot of times we as Black people sometimes hold everything back, myself included, because we don't know if it's a safe space. And are you going to call social work? And who else are you going to bring in? Are you going to say, I got mental issues and this is really all in my head? So we wanted to make sure it was an intentional space that when Black women came in, they knew this space was created just for them. And so when you walk in, we do have one wall that is a Black art gallery, all local Black artists except for one piece that they donated. So the art gallery is up there with different art pieces, photography as well, with that artist's name. So that if you decide you want to go on their IG or email them or whatever to purchase some of their artwork, you could also do that. Each room is named after a Black person in history, from the Henrietta Lacks Lab down to our 3 exam rooms, which are all named after the 3 enslaved women who were tortured in the name of gynecology. These women were practiced on without any pain medicine. They had over 30 procedures done to them each. They were tied down so that the pain from the procedures wouldn't elicit involuntary movements to interfere with him practicing his stitches. Then they were also rotated in as his assistants. And this continued on as torture for 5 years. This man became known as the father of modern gynecology. He's listed in textbooks today. He has some statues across the country. We wanted to recognize these women as the mothers of gynecology. So each piece has the name in addition to paragraphs that describe that person. So we're also doing education. All of our artwork is Black women. My office in particular is dedicated to Black women whose shoulders I believe that I stand on, from Nina Simone to Angela Davis down to Elizabeth Eckridge. And so all of these pieces were put into place to create this system down to the red exam tables, because we knew we wanted women to walk in and feel happy. We get women all the time taking selfies on our exam table in the mauve gowns, which I just ordered because I thought they were cute. But for women, especially Black women, this was an exciting thing for them. And so you'll see them post on social media in their gowns and things like that.
Okay, I'm just looking for your website.
She's bound by HIPAA, so she can't say this, but I am one of her clients, and I love going to the center. I'll be in the hallway, feet, shoes off, having a good old time with them because it just feels like family. It feels really good there.
Meredith, I was going to just try to summarize some of the comments that are in the chat. I just want to uplift, because there are women who are stating that they have lost sisters, lost children, lost loved ones. And I just wonder if any of you can comment, and maybe starting with First Year Cleveland, about grief and support for women who are grieving or who do experience loss, or for families who lose a loved one in the act of childbirth.
So, well, First Year Cleveland, we don't provide direct service, but we do work very closely with Birthing Beautiful communities through what is called the Pregnant and Infant Loss Group. So it's the PALE committee that does honor families that have experienced a loss, not only an infant or child loss, but a miscarriage as well. I think that is the one, I think we have not done a great job at acknowledging miscarriages, because the data, unfortunately, is not collected as consistently. And so I would assume that there could be significant inequities also with women that have lost children prior to, 22 weeks being pregnant, at which time it could be a fetal loss. And so, we definitely, I'll let Jasmine talk about the OWN network, Our Wellness Network, and also the PALE group work. But there's also, the county itself has a fetal infant mortality review that it looks more closely at what the hospital systems could be doing better to support families. Because we found that the work that we were doing in 44128, which Dana referred to earlier on the call, was that we found out that we have a labor and delivery desert in Cuyahoga County. So out of the seven labor and delivery hospitals, 2 were on the east side and 5 were on the west side. But 50% of the births are on the east side, 60% of the deaths are on the east side, and the east side population of our Black patients was much higher than the west side. So of course, the systems were prioritizing where they put their labor and delivery hospitals. And so, it was because of the shared stories of the women that had lost their children that we made this discovery. Folks talking about how I presented at this emergency room, they sent me clear on the other side of town. And we're like, I didn't even realize it at the time. And so I am grateful to hear that University Hospitals is now, working to open up a labor and delivery hospital in the Southeast quadrant, because I'm talking about where it's like South Point, Ahuja, and all that is. None of those hospitals deliver children, but there's a lot of limited transportation issues and things like that. But I'm just going to kick it to Jasmine to talk. You want to talk about PALE and
So one of the things that we do, and I see my colleagues, Jackie and Tanya and Krista are on the call right now, is that we do support folks who have had a loss. And what I want for us as Black women is to acknowledge whatever that loss is for us. So infant mortality means a baby took a breath. It doesn't necessarily categorize miscarriage, stillbirths, and those things are very real. I think about, as I was growing up as a young girl, when my grandmother would tell me, oh yes, my great grandmother, she had 12 children, but the twins died. Or for my older sister, she has a set of twins who passed away. And we normalize this, because they just say, oh, grandma's twins died, my siblings died. And we think that's normal, when it's okay to envy our Black women who have to keep pushing forward, and that we're not necessarily allowing ourselves the space to grieve. And so what I'm appreciative about, we have at our wellness network in PALE, is that we have 37 licensed grief recovery specialists who are all African-American, lay people, licensed therapists, and clergy members who are able to provide grief recovery support to our community. And even when we look at grief, it's not just the loss of a potential child, right? We can grieve the life that I thought I was going to have before I had kids, grieving who I thought I was going to be when I was 12. Those are real things that we can process and acknowledge in order to really allow us to have a healthy self. And so we are super focused on what does it mean to be healthy and whole. Dr. Rice does a lot of our research for us. And in these research components, which is why she's really on our backs about IRB and this and that, she is able to interview folks and allow this to be put on public record in articles and in journals, so that folks can really recognize the plight of Black people. I know Dana's going to touch on this. She hired a mental health practitioner who is already booked up. We have a mental health practitioner who's already booked up because we are allowing folks to feel like they're in safe spaces. There are women who come to our office and they're like, I've never said this to anybody in my life. Why am I telling you this? Because we allow for people to let their guard down, and we allow for a safe space that just feels good, that just feels right. And so this is very important to all of us. And if you want more information, I'll send Councilwoman Turner information about PALE. So if you have had a loss, they have support groups for each other. They do things with each other so that they're supporting one another. You muted.
Right, I'm on mute. I'm looking for that question. There was someone who asked, what advice would you give to a younger woman in her 20s preparing? You see that question?
Yeah, I see it. What is the best advice that you can give to someone in their late 20s and preparing her body for pregnancy and delivery? I think first and foremost, start seeing a provider now, somebody that you trust, because you want to build that relationship now and you want to do preconception counseling. So you want to have conversations with them about what pregnancy looks like, how to get healthy prior to the pregnancy, some things you can do now to prepare your body for the pregnancy, and questions you should be asking. But I think the biggest thing is start researching that provider now, because once you get pregnant, you already have that relationship with that provider. They'll know you. You would have built that relationship, and then you can grow it from there. But there's some preconception things you could do, vitamins you can be taking, all of that. You have that conversation with the provider.
Okay. I had an inbox for you. I'm losing all of these messages. Okay, I cannot find it. I'm sorry, y'all. I'm looking for this. Denise Rucker Burton, my co-chair. She says, thank God for all of the presenters and the work you're doing. Over 27 years ago, she had a brush with death after giving birth to her first child, had a Black obstetricianist, and a family who listened and were relentless with the medical personnel. All that made a difference. She says, we are each other's keepers. She wanted to know, how can we donate to your agencies? Can we donate to your agencies? How can we do that?
So yes, I mean, all of us have donor links that you can go to on our websites, Village of Healing, CLE.com, and Birthing Beautiful. I think it's birthingbeautiful.org, correct? Yeah, so definitely, and you can go to any of those to donate. Also, shameless plug for me, on August 4th of this year, we will be hosting a fundraiser at Sapphire Creek to raise money for our expansion, because we do understand the need, and I am a person that wants to meet the need. I don't want to sit and just talk about the statistics. So we're opening up a second site in the Buckeye Shaker neighborhood, and that site will include our PEDS postpartum model, which will be the first as well in this state, to include your pediatric, your first year of your newborn appointments, and the first year postpartum appointments together. So gone are the days of going to one side of town for your pediatric appointment, the other side of town for your postpartum appointment. You'll be able to do both of those same day, same visit in the same office. In addition to that, we'll be adding primary care, because like we talked about with all those chronic illnesses and diseases, we see Black women are coming in to see us for GYN with blood pressures 200s over 100s. And so what we're doing is we now see that there is a need for primary care. And they are saying, well, if you don't get primary care, I just won't go. And so we're going to provide that service for them and extend our mental health services. So we'll be doing that August 4th. And I'm sure Jasmine has something of her donating.
I said, Dana, stop telling my business, because I'm one of the ones who come in with that high blood pressure. And she's like, girl, if you come here one more time with high blood pressure, we about to do some medication for you. So I gotta, de-escalate my own self, because she got me together. And so we'll make sure to send you the information about the fundraiser. But I would also say that we actually just hired someone full-time, Latanisha White, who has been doing teen and youth prevention work in support for years, because we do have a high population of teen clients. And for us, we usually stay with our clients for a year postpartum. But for our teen clients, we actually stay with them until they graduate high school, because we want to ensure that their baby is not a barrier to their success, and that they have all of the wraparound. And that means for the young men and women as well. And Dr. Rice can speak to this, because she steps in and supports a lot of us who are working with teens, doing focus groups, making sure the babies have Chipotle. You get them a little Chipotle, they'll do anything. And so they're very happy to have those kind of wraparound support services that our organizations are able to provide, because we really want to support everyone who's at need. And so that's just important. This is making my heart happy, because I love to be with my sister. So thank you.
Let's see. There was a comment. Lakeisha, she just wanted you to know, Danae, that this is an amazing space that you created for women of color. Your intentionality, passion, and commitment to ensuring that we have adequate care is second to none. Carolyn mentioned the history of treatment of Blacks in medicine. So this was a book, An American Health Dilemma, Race, Medicine, and Healthcare in the United States by W. Michael Bird and Linda Clayton. So I guess that's some recommended reading. And that's a very dark topic. Anybody want to talk about that?
I think the biggest thing is that we have to recognize that the healthcare system was built on racism from the very, very beginning, right? We talk about it and we see it with Anarcha, Lucy, and Betsy, those three women that I talked about earlier, all the way to the eradication and the systemic eradication of the Black midwife. When white OBGYNs came into the field, they said the Black midwives were dirty, they were infectious, and that they increased the infant mortality rate. What we know is that they decreased it. And when white obstetrics came into play, they increased the rates and brought in infection. And they started putting out ads and papers with white public health nurses to arrest and find Black midwives who were delivering most of the South. They went from delivering about 60% of the babies to less than 15%. And right now we see only 8% of midwives are Black in this country, all the way to the opening of the first hospital, where once we were freed from slavery and we started getting infections and things like that and dying in the streets, the white elected officials at the time said, let them die. Because they were trying to prove that Black people were meant to be slaves, and if they were free, this was the result. So they wouldn't let us in their hospital systems. So this is just a buildup, as you can see, over decades and centuries of what we've been fighting. And so here we are today, and we want to walk in and say, let's do this 1 hour bias training once a year, and it's going to solve and end all the problems for us, which is impossible. But number one, if we're going to recognize bias, let's recognize that it's racial bias and that we're doing anti-racism trainings. And this should be a year-long required training for the hospital systems to do and for the providers to do. And so it's just a very ugly history when it comes to race in healthcare, but we have to recognize it and address it. And I think right now that's the special place that we're at, that there are some of us that are recognizing and addressing it. But a lot of the hospital systems are still fighting that and saying, it's not us. We don't have that. We're fine here.
I also just want to add,
Yes, ma'am.
this past February, I actually traveled with Tanisha Gaines, who's also at the Village of Healing Center, and we went to the Mothers of Gynecology Conference, where we actually visited the facility where Mary and Sims were experimenting on these women. And it was important for me to be kind of immersed in this history and in the midst of Montgomery, Alabama, where so much of that racism kind of stems from and is tied back to actually going where the slaves were let out and walking the streets to where they were taken before they were stored, in a space that is still a bank and has been kept exactly the same. It looks exactly the same because it's a historical place. So they cannot change the way it looks. So I felt that that was important for me, because the reality is, you know, I have a degree in biology, I am a registered nurse, I have a master's in nursing, and I have a PhD in nursing science. And the reality is that I have not been taught these things as a provider, as a clinician. Those things did not come into place until I started to do research specifically about why are PhD prepared women experiencing such terrible maternal outcomes. And then when I saw what it was spanning back to, I was more open to learning more about medical racism. And it goes through even in a pediatrics level. We even see that children who are coming out post-operatively are offered less pain medicine than Caucasian kids that have had the same procedures. So I'm very intentional in my teaching that I address these conversations with my students. I know it's uncomfortable. People tend to not want to have those conversations, but until we're transparent and open and honest about how the medical systems, our medical history, and racism still lives within our hospital system, still impacts quality of care, the direction of the plan of care, and the way in which providers interact with their patients, we will not see improvements in outcomes. We have to be able to see it, identify it, call it out for what it is, and then come in and make sure that we have, as Dana stated, that anti-racism training, and that you're forcing people to address difficulties when you've identified that you have a challenge in that area or you've compromised care because of your own biases and beliefs.
I have a quick question, and then we're going to wrap it up. I was at a meeting recently at Tri-C for the collaborative. Angela, I think you were there, and probably all of you were there. I don't think you were there, Danae or Heather, but anyway, someone mentioned to me afterwards, a newcomer to town in the health care system space, that why were all the people in the audience Black when we were talking about racism? What are your thoughts around that? Because we know what racism is.
So I actually just brought this point up when we did our aftershock panel with Metro Health Hospital, because so there's a couple different things, but whenever there is a function where we talk about these items or racism in healthcare and all of those things, Black folks show up. And this is what I talked about earlier with the idea of comfort. And so unfortunately, white people, especially in these systems, aren't made to feel uncomfortable. They're just not. And they don't want to be placed in positions of discomfort. I was recently told, someone brought up at one of the hospital systems, you know, we need to be having anti-racism trainings, and the comment from the head of diversity, equity, and inclusion to them was, well, first we have to make them feel comfortable to come to the space and come to the room. Well, while we're doing that, Black women are dying. Black babies are dying because we're focused on the comfort levels of those that are supposed to be taking care of us and have taken oaths to take care of us. And so I think that, you know, when we're placed in these positions for these forums, that's who's going to always show up. And so what we have to start doing is when folks say, I'm an ally, and post a Black square, or our neighbors put the sign in the yard and say Black Lives Matter, we have to start challenging white people and other races too, because it's not just white people, Asians too. But we have to start challenging them to, what are your action steps to show that Black Lives Matter? Make them tell you, make them have the conversation. And if they don't, there's a forum going on, I suggest you go so you can really hear the outcomes. Because there was so many people in my inbox when Aftershock came up saying, and they were white, I just watched Aftershock, your work is amazing. Well, come on down to the Village of Healing Center. Make sure you please donate on your way down so that we can continue to do the work. But then come on down and do some volunteer hours with us so you can truly see what's happening in the community that all you got to do is drive 5 minutes to get to.
Okay, and that's a wrap. Heather, Angela, Jasmine, Danae, we thank you for all that you were doing, and we want to continue to uplift you and the services that you provide to the community. I want to thank all of our presidents, our amazing partnership with NCNW. Called them NWA earlier, y'all. To President Rollins, to my co-chair in this work, Kalia Fisher-Grace, and her co-chair Crystal, my co-chairs Aaliyah, Denise. We thank you, the audience, for continuing to show up and support our programming. We hope that the information shared today from these trusted voices have helped you to become informed about the state of Black maternal health. We encourage you to refer to the resources shared in this conversation tonight for more information. I was dropping links. Please take a moment to complete the evaluation. I know that there were some challenges, and then I dropped some more links. You'll also get an email at the conclusion of the call if you weren't able to access it during the call. I want to bring on really quickly, President Jones, did you want to talk about the program that you're having coming up?
I would love to. Thank you, Councilwoman Turner. To those panelists, first of all, thank you. I've taken 12,000 notes over here. I think I may have even written on the table. So thank you so much for the information. And with the work you're doing is definitely in alignment with the National Council of Negro Women. On June 17th, we are hosting our annual Family Fun and Fitness Health and Wellness Fair. This event is being held at Zelma Watson George Recreation Center, which is in the city of Cleveland, and it is going to be what we're calling a one-stop shop for women, children, families, seniors. There are over 50 resources available that day, everything from the city of Cleveland Department of Emergency Management to legal aid, to veterans help, to seniors help. We have everything that day, and it's a free community outreach for the community. Our goal that day is to have this event. It's mission driven. Our mission is to lead, advocate, and empower African-American women, their families, and their communities. The goal that day is to do that. I would encourage you to please pass this around to your networks and please come. It will definitely bless you that day, and we'll be able to pour into our community. Thank you for the opportunity.
Thank you, President Jones, and to the other presidents. Our historic organizations, both Delta Sigma Theta, Greater Kundalini Chapter, and the National Negro Council of Black Women will continue to work to improve the physical and mental health of our communities. We will continue to use social action to advocate for health justice. I want to bring on Talia to close it out and talk to us a little bit about the Black Family Health Awareness Week.
Sure. Thank you, Meredith. Just be on the lookout. We will be in partnership with many other organizations the week of June 15th through the 21st as we promote Black Family Cancer Awareness Week. So you can check out our sorority's webpage. Again, for all the events that will go on there, there's much work to be done around health justice. Certainly, we wanted to highlight the work that needs to happen in the maternal health space, but there are also disparities in cancer care and many other things. So nationally, June 15th starts Black Family Cancer Awareness Week, and we will be collaborating with our community partners, so more to come.
All right, well, thank you, Essence. Thank you to our sisters. Thank you to everyone that was on the call tonight. Thank you, Madam President. And that's a wrap. Cut.
Have a good night.
Good night.